Alrighty, everyone. Week 1 in the books. And I'm not gonna lie. It was kind of a bit of a rough week. I didn't really prepare myself as good as I should have, and it sucks because I did a lot of research prior to wanting to even do a hair transplant, and I thought I knew everything. I thought I was gonna be set up for everything, and I did all right. One thing that I should have done that I really regret not doing prior to getting my whole hair transplant done is making sure that I practice sleeping elevated. That was a huge pain in the butt. Especially me, I'm a back sleeper and I really enjoy sleeping on a flat surface. So for me, there's times where I even fall asleep and I literally have my hands behind my head just passed out. So I should have prepared for that maybe the week prior to get my body a bit adjusted to it because sleeping was a huge pain. But nonetheless, got it done. No complaints in that aspect of it. I did originally go to Chicago to get some stuff done, so I had some B-roll to that, and it was cool. It was nice. I'm originally from California. I'm stationed in Texas, and I had to go to Chicago to do my surgery. So I went to downtown, checked some things out. No complaints there. I also went in and I was told originally that I was going to have 1,200 grafts. When I ended up showing up, Jill, the nurse practitioner there, was like, hey, I don't even think you need more than 300 on each side. So a total of 600 in the front of my hairline. And then for the crown area, they put in 100 because I told them that I do have some thinning there. One thing to expect, and I hope everyone that's been doing research by now knows, shock loss. Ended up happening, especially towards, I wouldn't say too bad towards the front of my hairline, but towards the crown, I've definitely been experiencing it. So it's going to grow back. It's going to take time, and I do understand that. It's a bit of a bummer. I'm not going to lie. My friend is getting married in less than 2 months, and I'm one of the groomsmen there. So I definitely didn't choose the best time to go and get a hair transplant, but I definitely wanted to get it done during the winter because I do like being outdoors. I like paddleboarding. I like doing certain things. A lot of activities that have me out in the sun. And when it's winter, I'm not as active because it's a little too chilly to do some of the things that I like to do. So it is what it is, right? We've all been there. We all make our choices and we go from there. Other thing that I could suggest, maybe wanting to get more hair. You know, originally she did tell me 300, but if you pay attention to my frontal forelock, you're going to see it's pretty thick in that area. And if you compare to what was transplanted, it's a lot thinner. So one concern that I have, it's not going to be a super solid hairline. And I wasn't looking for that by all means, because naturally as we get older, it's going to recede. But I would prefer to have a little bit more hair to match what's in the middle. I can't judge it until we hit 12 months, even up to 18 months. But for the moment, I'm not going to freak out. There's nothing that I can do about it. I just got to roll with the punches. So we're going to see how that comes out. I'm going to keep everyone, posted on each week how everything goes by. And one other thing that I want to mention as well, I do have the iRestore helmet. So I will be using red light laser therapy every other day for about 25 minutes each time I do the session. I was told I shouldn't be using it until week 2. I just started using it and it's day 8 for me now. My goal is to see if it helps with the healing, just because of the studies of red light therapy involving healing, and seeing if I can get that redness or that irritation gone as soon as possible. Because I do notice there's people that end up getting that redness for 6 months, 7 months, even 4 months. Obviously everyone's body's different, so we're going to see how it goes. But hey, I don't mind being the test dummy to try it out and see if it actually helps with the process of healing, if it speeds it up, or if it just doesn't really do anything. I did use iRestore a little bit, probably about 3 months prior to getting my hair transplant. It helped my hairs that were like baby fine hairs, especially towards the front of my temples. It helped them grow a bit thicker. So I guess restoration in a bit. So I'm not expecting to get a full solid hairline, full of hair, good to go. So I'll keep you guys updated on that. And if you have any questions, just let me know in the comments below. And yeah, I still don't know exactly what I'm going to make the channel about. I definitely want to make it about hair restoration, but at the end of the day, I want it to be overall men's health and wellness and improvement. We'll call it men's improvement. For example, one thing that really bothers me is men will go and get steroids, they'll get jacked, they'll work out, they'll do everything, right? They'll go get a hair transplant, but then they don't want to take care of their skin. So you get a lot of people that get this super fresh, crispy lineup. They're all jacked, and then they have the face of like a 80-year-old man, and they're only like 20 or 30 years old. Now, I might be exaggerating, but you get the idea. You know, you can't just work on certain parts of the body and not work on the rest. You got to do the whole thing. So I'm going to make sure to hook you guys up on some tips and some things that I've been using. And yeah, I'll keep you posted. Till then.